Assalamualaikum and hello to our lecturer Miss Farhana binti YAAKOB and everyone. We are from Group B. We'll talk about our newspaper article review with the title of Bandar Kuching MP Use e-cigarette tax revenue to support healthcare workers' pay. I am NURSAHFIRAH binti SAPRI will present with my teammates Cliff JULIUS, MUHAMAD YAZID bin YAAKOB, TABITHA SIMBIH GILINGAN, and YUZWAN bin YAAKOB.
Hello to Miss Farhana and fellow classmates. I am TABITHA SIMBIH GILINGAN. I will be the first presenter to present our newspaper article with the title Bandar Kuching MP Use of Cigarette Tax Revenue to Support Healthcare Workers' Pay. This newspaper released on the March 2023 by Code Blue, where it is discussed why the cigarette tax will improve the healthcare system for everyone. So, Bandar Kuching MP Dr. Kevin Lee has called for utilizing revenue for proposed exercise duty on e-cigarettes and vape liquid containing nicotine to provide fair wages for healthcare workers. Therefore, he proposed reviewing on the on-call allowance and collaboration between the Public Service Department and the Ministry of Finance to ensure fair compensation. He also emphasized the importance of proper management and allocation of resource in the healthcare system and proposed establish a task force to monitor development expenses and reduce wasteful spending. He also suggests increasing tax relief to prioritize preventive care. Structural reform in the healthcare system should receive more funding, focusing on health financing, human resources, and service delivery organization. Furthermore, he recommends 3 stages for the 2022-23 budget, which is prioritizing prevention and primary care, allocating more funds for structural reforms, and addressing the social determinants of health to reduce hospital congestion. Dr. Yee welcomed the Control of Tobacco Product and Smoking Bill 2022 as a measure to protect future generations and reduce healthcare costs related to smoking illnesses. That's all for the summary part. I will pass to the next presenter to highlight the main issue in this newspaper. Thank you.
Assalamualaikum and hello to our lecturer Miss Farhana, also all my friends. My name is MUHAMAD YAZID bin YAAKOB. Today I will present about our finding based on the newspaper article about Bandar Kuching MP e-cigarette tax revenue to support healthcare worker pay. The first issue is tax fund from e-cigarette and vape that need to be used for cover the salary set for healthcare worker. How do we get this issue? In the paragraph 7, when we do some reading, we have detect when Code Blue has doing the survey, and about 1,205 people has considering to leaving their government health care worker. What is really happened in this issue? So the answer also have been highlighted in the news at the paragraph 8, which is firstly is a work burden, understaffing, unfair paying, and last but not least, insufficient amenities and equipment in the public healthcare facility. Here can we see when the salary of worker, especially for the contract staff, is unfair. It is because the contract staff also doing the same workload but they have been paid lower than the permanent staff. So why we alert more to unfair paying than the other issue? It is because we have do some research and more details about this issue. Then then it is the most issue among the healthcare worker is unfair paying about their salary. In that case, the government need to use 50% from the tax to support the salary of worker, even though we know the government have been give the budget about 3 million ringgit, but we know it's still not enough to support their salary. And the second issue is the tax from the e-cigarette and vape is used to cover the primary care of government hospital. Again, what makes me what makes my team and I get this second issue? Okay, as Dr. Yim mentioned in the news at the paragraph 10, uh, the fund should be channeled toward reinforcing primary care on the initiative to address issues such as non-communicable disease, which is like diabetes, hypertension, and high cholesterol that we know every year it will be increased for sure. So Dr. He have give his opinion that to make sure the government also the government also can do some effort that can give to give the full care to the people who have this disease, and also by providing service with the best facility in the government hospital. It is because, as we know, due to the fact there are more people with the low income, so they still need the government hospital. Therefore, government need to use at least 50% of the tax to make sure the service and also to stable by adding facility at the government hospital so it can support more patient. And our last issue is the government need to look forward about initiative where to reduce waste and leaking of fund in the healthy care sector. What is mean here? When the we know MOH have been give budget that have been allocated for MOH needed to be used the best as possible to avoid the waste or deviation. It is because when the deviation found happen, especially at the project under MOH, and for sure, MOH will lose fund and uh, and cannot to be upgrade their facility, or even more worse the project being abandoned and will be, and for sure it will be give the negative effect. In this case, the management need to get their role and take responsibility to make sure all the work can be done on the time. Not just that, the upper management also need to alert and need to create a body where they will monitor every project, especially under the MOH, so that the waste and corruption among the staff, contractor, or even the top management can be taken action. So that's all from me. Thank you.
Assalamualaikum and hello to our lecturer, Miss Farhana, and fellow classmates. I am NURSAHFIRAH binti SAPRI, will present the related theory on the issues based on our newspaper article. For the first issue, the related theory is tax revenue collected by Malaysian government. The related tax revenue to the use of e-cigarette and vape is excise tax. In Malaysia, an excise tax refers to a specific type of tax imposed on certain goods produced or manufactured within the country. Excise taxes are primarily imposed on goods that are considered to be harmful for the public health, such as tobacco products, alcoholic beverages, and certain luxury goods. The revenue generated from excess taxes is typically used by the government to fund various public services and initiatives. So, based on the newspaper article, yes, it is supposedly to use e-cigarette and vape tax to support the fair wages for the healthcare workers. Next, we move to the second issue, which is use of e-cigarette and vape tax to support primary care in government hospitals. The related theory with the second issue is outcome-based budgeting system in Malaysia. The outcome-based budgeting system practiced in Malaysia refers to an approach in public expenditure management activities that aims to shift the focus from measuring activities and expenditures to the attainment of goals and desired effects. Based on the budget 2023, Ministry of Health received 36.3 billion ringgit compared to 32.4 billion ringgit last year. So, one of the initiatives to be fulfilled based on the budget is the government will start preliminary work to upgrade 26 hospitals, including the expansion of Kuala Kangsar Hospital, Jelebu Hospital, and Pontian Hospital, which is almost a century old. As we can see, the Malaysian government is trying its best to meet the demand of Malaysians to get the best quality towards healthcare sector in this country, especially for the low-income group, which is a B40 group. Lastly, the issue of reducing wasteful spending in the healthcare sector is related to the concept of accountability and auditing. Accountability refers to an obligation of an individual or organization to account for its activities, accept responsibility for them, and to disclose the results in a transparent manner. The accountability concept practiced in Malaysia is really important to justify any action that results in inflow and outflow of the government fund to ensure it is a benefit for the public at large by spending it properly, and responsible for any single cent being spent to avoid wastage and overspending. Next, auditing concept practice in Malaysia, especially compliance auditing that conducted, can guarantee that all financial records of ministries, departments, or agencies are consistent with the rules and regulations. Most activities that are audited for compliance are management control, revenue control, expenditure control, management of trust funds, and management of assets. Here, we can see our government able to inspect and evaluate the activities of ministries, departments, and agencies, whether they do their work in a sense of responsibility by avoiding any corruption and mismanagement. So, I hope everyone can manage to understand on how each theory is applicable and related to our newspaper article. That's all from me. Thank you.
Bismillahirrahmanirrahim. Hello to Miss Farhana and also fellow classmates. Well, I'm YUZWAN bin YAAKOB. As the next presenter, we'll continue to talk about the government initiative. As we know, the main purpose of the e-cigarette tax is to support the salaries and needs of the healthcare workers. This is the main point of the issues of the problems that arise to ensure that workers' salaries and hospital needs in government sectors can be met in line with the current situations. On the other side, of course, the government is also not exempt in making other plans so that these problems can be solved deeply. Well, in reality, Prime Minister Anwar Ibrahim announced an allocation of 36.3 billion for the Ministry of Health, as known as MOH, in budget 2023. Well, this budget allocation is the second largest of the other ministries. Key component of this allocation is include the needs for the procurement of medicines, reagents, vaccine, and also consumables, including an allocation of 3 billion for over 1,500 long-awaited permanent appointments and contracts of medical, dental, and pharmacy officers. This government initiative is the largest allocation from the government to the Ministry of Health in covering the issues of workers' wage and hospital needs. Besides, referring to the presentation of the same expenditure, the government also created a Madani medical scheme in the form of the special credit facilities for community people in B40 group to get health treatment at clinic, general, and private medical practitioners. Limited facilities and the burden of the Ministry of Health in the dealing with the treating large-scale patients can now be curbed through the scheme. In fact, this is also encourage the patient to have a comfort and receiving their treatment. Well, in addition, the Malaysian Anti-Corruption Commission, as we known as MACC, implemented targeted programs involving government's procurements, well, public funds or government allocations, and the enforcement sector throughout the year to prevent corrupt practices. The implementation of these target programs focuses on issues that, such as cartels, leakage of government funds, violations of the law, and inefficiency in government revenue collections. These programs also provide benefit and advantage to MOH in avoiding the existing of the issues that misappropriations of the allocations fund channeled by the government to MOH. Well, this is the same time can ensure that the allocation of funds channeled can be received according to the expenditure breakdown that has been arranged and used in the best possible way. Well, that's all for me. Perhaps I bring the new knowledge for everyone about this part. I will pass the next presentation to my Mr. Cliff for from my members team to continue that slide. Well, thank you everyone.
Hello to our lecturer, Ms. Farhana and fellow classmates. I am Cliff JULIUS. Here I will present the recommendation based on the issue we found in the newspaper article. For the first issue, the government of Malaysia need to review and revise the salary structure since the government already haven't really revised it for more than 10 years. The government can conduct a comprehensive review of the current salary structure for the healthcare workers to ensure that it aligns with the industry standards nowadays and fairly compensate them for their hard work. Secondly, allocate 15% of the VAT tax fund to support the salaries, just like what the MP Kuching suggested on the newspaper article. Dedicate a significant portion of VAT tax fund to support the salaries of healthcare workers will fairly recognize their valuable contribution and motivate them to continue providing quality care. Third, the government can address salary discrepancies. Government need to identify and rectify the existing unfair salary discrepancies within the healthcare sector to ensure equitable compensation, therefore enhancing motivation and retention among healthcare professionals. Next, I will discuss the recommendation on the second issue. Firstly, the government recommended to channel the tax funds toward the primary care in hospitals. Allocating a substantial portion of the VAT tax fund can help to strengthen the primary care service in the government's hospitals. These investments will empower healthcare providers to deliver comprehensive care with a particular focus on addressing non-communicable diseases such as diabetes. Second, the government must enhance the healthcare services and facilities by utilizing the VAT tax fund for the facilities in government hospitals, which more focused to provide good services for low-income individuals who heavily rely on government hospitals. This allocation will bridge gaps in accessibility and ensure quality care for all. Lastly, to reduce the wasteful spending in the healthcare sector, the government needs to ensure an effective fund utilization by establishing a mechanism within the Ministry of Health to monitor project implementation and expenditure in this sector, because prioritized good governance can ensure the funds are effectively utilized for their intended purposes. Moreover, the government must establish a task force for oversight and comprising the relevant agencies, such as MOH, Ministry of Finance, Public Work Departments, to oversee the allocation, implementation, and procurement process in healthcare projects. This force will ensure transparency, efficiency, and accountability in financial management. So, in conclusion, by implementing all these recommendations, the government can essentially build a more equitable and efficient healthcare system that benefit both healthcare workers and patients alike. Let us work hand in hand to ensure a healthier and brighter future for all. Thank you.
Conclusion. In a nutshell, the implementation of this e-cigarette and vape tax can have a significant positive impact on the funding of health department, alleviating the financial burdens they face, particularly in terms of operational costs and healthcare worker salary. By levying tax on products associated with unhealthy behavior such as tobacco and alcohol, the revenue generated can be directed towards supporting the need of health department. This infusion of fund will address one of the most obvious challenges faced by the health departments, allowing them to adequately compensate and retain skilled healthcare professionals. Furthermore, the utilization of sin tax revenue to patronize preventive care initiatives can effectively reduce the burden on a primary care service. By promoting and investing in preventive measures such as health education campaign, screenings and vaccinations, the overall demand for primary care services can be minimized. This approach not only benefits individuals by fostering healthier lifestyle and early disease detection, but also empowers healthcare workers to function more efficiently. To sum up all our presentation, the implementations of e-cigarette tax serves as a valuable solution to the financial challenges faced by the Ministry of Health. The introduction of this sin tax thus presents a promising avenue for bolstering the overall capacity and effectiveness of health department in promoting public health and well-being. We hope everyone will find this video presentation as a valuable content. Thank you for watching. Keep exploring, keep learning, and keep growing. Bye.